Welcome to the Diet and Heart Health video by the Heart Health Intervention Program. Here are 6 general recommendations to eating healthy. 1. Eat a diet rich in fruits, vegetables, and whole grains. Don't overcook your vegetables. Try steaming or baking them instead of boiling, so they keep more of their natural flavors, textures, and nutrients. 2. Eat poultry, fish, and nuts, and limit red meat. Select lean cuts of meats and trim off any visible fat before cooking. 3. Limit how much added sugars and sodium are in the food you eat. Adding salt to your food makes you eat more calories, studies show. You can use herbs and spices to add flavor to your foods instead. 4. Limit your saturated fat and especially trans fat intake. Trans fat can be hidden in foods, but they can be found in cakes, pies, cookies, frosting, biscuits, breakfast sandwiches, margarine, crackers, and microwave popcorn. 5. Limit beverages and foods high in calories and low in nutrition. This includes sugary drinks, such as energy drinks, sports drinks, flavored waters, soda, teas and coffees, and fruit-flavored drinks. 6. Eat protein and fiber to lower caloric intake. The thermic effect of food is the amount of calories you burn digesting that food, and this is the highest for protein, then carbs, then fats. Protein also has the highest satiation rate, over carbs and then fats. Dietary fiber increases satiety also, and may decrease the amount of energy we get from food. So, increase your protein and fiber intake, and you will lower the amount of calories you get from your food. However, if you eat a high-fat diet, you may overeat. Here are various diets that can help you lower your cardiovascular disease risk and lose weight. Feel free to pause the video to explore these different diets. All can be effective for weight loss, but they must be calorically restricted to be effective. Some weight management tips. Know your portions. You may be underestimating the amount of calories you're eating because you don't know your portion sizes. Also, always keep low-calorie and heart-healthy foods around, so you have something to grab when you're hungry and want something quick. Also, plan all your meals. Don't grocery shop when you're hungry. And if you're hungry between meals, drink a glass of water or eat a small piece of fruit. When you really crave that high-calorie food, just eat a small amount of it. And also, add more healthy foods, instead of subtracting the less healthy ones you love. This will help you stick to diets in the long run and not quit. If you want more information on eating smart to reduce your cardiovascular disease risk, look to the American Heart Association's diet and lifestyle recommendations. Now we're going to talk about obesity and heart disease risk. It is well known now that obesity is worsening in America. From 2013 to 2016, 38.9% of adults had obesity and 7.6% had severe obesity. You can see the chart to the right and see how both adult and youth obesity rates are increasing from 1999 to 2016. Obesity is defined as a BMI of 30 or higher. In males, it can be a 25% body fat or waist circumference of over 40 inches. And in females, a 32% body fat or waist circumference of over 35 inches. Here's a chart showing your BMI based on your height and weight. Feel free to pause the video and see where you are on this chart, whether you're underweight, healthy, overweight, obese, or extremely obese. Body fat and heart disease risk. An increase in body fat can directly contribute to heart disease through arterial enlargement, ventricular enlargement, and atherosclerosis. Further, Increased body fat indirectly contributes to heart disease through promotion of sleep apnea, thromboembolic disease, and onset or worsening of metabolic diseases that are major cardiovascular disease risk factors, including dyslipidemia, type 2 diabetes, high blood pressure, and metabolic syndrome. Other factors include mental stress, neurologic dysfunction, viral infections, and inflammation that affects the heart. Here are some obesity-related disease vocab. Dyslipidemia is an abnormal amount of lipids in the blood. Dyslipidemia increases the chances of atherosclerosis and heart attacks, stroke, or other circulatory concerns, especially in smokers. Thrombosis or embolism is the formation of blood clots inside a blood vessel, obstructing the flow of blood. This can usually cause blockages in the legs, resulting in pain, and eventually can get dislodged and end up in the lungs, where a pulmonary embolism happens, which can be fatal. Metabolic syndrome, which is also called insulin resistance syndrome, is a group of conditions related to metabolism that puts you at risk for heart disease and diabetes. It is well known now that cancer is highly associated with obesity or overweight people. In fact, overweight and obesity make up 40% of cancers diagnosed in the U.S., the CDC has found. 13 cancers are associated with overweight and obesity. A study shows that 55% of all cancers diagnosed in women and 24% of those diagnosed in men are associated with overweight or obesity. So this correlation is actually higher in women. Losing weight is the best way to reverse these conditions caused by obesity. Refer to the videos on diet and heart health and exercise and heart health to help get you started on changing your lifestyle. Additional resources come from the American Heart Association on losing weight and extreme obesity and what you can do. When lifestyle changes alone don't work, you may consider bariatric surgery, which has been shown to reduce heart failure risk. A study compared intensive lifestyle changes versus bariatric surgery in the obese, and they found that 4 years after the start of treatment, the risk of heart failure was nearly 50% lower in the bariatric surgery group. They also found that the bariatric group had fewer incidences of atrial fibrillation, diabetes, and hypertension. The bariatric surgery group lost more weight than those in the intensive lifestyle modification program. So if you are very overweight or obese, you may consider bariatric surgery to reduce your cardiovascular disease risk. However, consult with your doctor. Bariatric surgery comes with many risks, such as digestive problems, dumping syndrome, malnutrition, and more. Ask your doctor about all your options for losing weight.